Stephanie Wingerter is on the line with us from Dr. Leonard Maliver's office and from IRMC as we talk about something that is a very, very serious topic. Of course, we know that office specializes in urology, and that means that we always want to talk about prostate cancer, prostate health, and making sure that everybody's getting checked out when they need to be checked out. Isn't that right, Stephanie?
That is correct. Thank you for having me this morning.
My pleasure. Our conversation this morning brought to you by Marcus & Mack, a law firm representing injured people. Just let you know that siren you're hearing is an ambulance heading by, lights and sirens activated. Please give them the right of way. Make sure that everybody can get to do what they need to get done. Okay, Stephanie, so let's beat people up here about this prostate cancer thing because not enough people are taking it seriously, are they?
Correct. Correct. It's very important to get routine screenings. It's the best way to have early detection, which gives you the best outcomes.
Now,
who
should be checked out?
So, gentlemen, we typically start screening around the age of 50, and that will continue to the age of 70. People that have a strong family history of prostate cancer, which is your first-degree relative of prostate cancer, so your father, grandfather, or brothers, have a higher risk of developing prostate cancer, as well as gentlemen that have mothers or sisters that have breast cancer.
Oh, yeah. That's a new one. I hadn't heard that one before.
Yeah. They've recently, linked the BRCA gene to prostate cancer. So if you carry the BRCA gene, you have, a higher risk factor of developing prostate cancer.
Well, how about that? September is Prostate Cancer Awareness Month. We haven't paid as much attention to it as we should. We think of Movember because that's always a big thing around these parts. But September is actually Prostate Cancer Awareness Month. Stephanie, are there signs that you should be looking for when you're considering whether or not your prostate is healthy?
Yeah, there are signs and symptoms of issues with the prostate gland. And these signs and symptoms can indicate cancer, but they also are indicative of several other issues that are not cancer that deal with the prostate. So what cancer will do, the prostate will enlarge with the cancer, and that will start blocking off the bladder. So it's very similar to something called BPH, benign prostatic hyperplasia, that's very common in men. Mm-hmm. So some of the signs and symptoms you would look for is painful urination, straining to urinate, pain with ejaculation. You'll notice your stream is choppy, intermittent, sometimes weak in force. Erectile dysfunction. As the gland enlarges, it will start compressing on the nerves that feed the erection, so men start having issues there. Blood in the urine is a large one. The prostate gland tends to bleed a lot, so if cancer is present, it can bleed. And also, frequency of urination, especially at nighttime, where you're waking up more than 2 times at night to urinate. Mm-hmm. But let me reiterate, that's also symptoms of a lot of other disorders that would block off the prostate gland. So it doesn't instantaneously mean that there's prostate cancer there, but it definitely, makes us get a little bit more concerned that there's an issue going on and we would have to eliminate prostate cancer.
So when you do get into the examination and you find out it is or it is not, let's take it is, okay? It is prostate cancer. What happens then?
If it is prostate cancer, like with other cancers, there's all different severities of prostate cancer. Typically, we see in younger gentlemen, prostate cancers are much more aggressive than in older gentlemen, meaning that they're going to leave the prostate gland and metastasize throughout the body. As you age, typically over the age of 70, that's why they normally stop screening at 70. A lot of the prostate cancers are very low grade, so they're never going to leave the prostate gland, and we can just monitor them. But a younger gentleman, it's very important to get screened regularly, because if you do develop prostate cancer, it can move very quickly through the body.
Yeah.
So the treatments really range on how we manage it. Very rarely is prostate cancer terminal anymore. Even if it metastasizes, normally we can do something to reverse it. Now, granted, it's a process, but very rarely is it an end-of-life situation.
And that's not always been the case, has it? That's fairly recently that we've gotten that kind of a handle on the entire prostate cancer issue.
Absolutely. As technologies advance, medical care in all fields is definitely improving. So, it used to be very disastrous for gentlemen to have anything with the prostate go wrong. The procedures to either open the prostate, remove the prostate, almost guaranteed impotence and incontinence. And with, robotic surgery really taking off, we have a lot better tolerance when we're working with the prostate, removing the prostate to spare structures that could lead to complications.
There's a phrase that has come into being with, I think it's colon cancer. It's treatable and beatable. That
yes.
tends to apply now to prostate cancer too, doesn't it?
Absolutely, absolutely. Early detection is the best. Obviously, the earlier we catch it, the less interventions that need to be done, and the easier it is to reverse the situation, or at least get the situation under control. The further it goes, if the cancer should metastasize, it gets more and more complicated in how we treat it. But normally, we can treat it and get the situation under control where it's not going to, again, be terminal.
Stephanie Wingerter is our guest this morning, CRNP, and she is somebody who has great expertise in this area. And we gave a scenario where things were happening and you got checked out. It turned out it was prostate cancer. Many of those symptoms, as you said, can be indicative of other prostate issues. So what happens when it is not prostate cancer, but you obviously have some indicators that there's a problem? What's the next step in that process?
Well, first of all, we all take a big sigh of relief.
Yeah, there's that.
But normally then you're going back. Typically, it's a bladder outlet obstruction. Something's obstructing the bladder from being empty. Normally, it's an enlarged prostate, which affects 80% of gentlemen by the time they're the age of 80 years old. So very prevalent. And then there's a lot of different ways to treat an enlarged prostate. Medications, and we offer 2 different procedures that can open up the prostate. I always like to tell my patients, because so many hear of the old Roto-Rooters, the old procedures that were just very, very difficult to go through. It's not like that anymore. With technology, you're in and out the same day. It's not something men need to be afraid of. And it will greatly improve their quality of life, because waking up 4 or 5 times at night, leaking urine, this all greatly affects your quality of life, and you just don't need to live like that, and you don't need to be afraid of the procedures anymore.
Yeah, and that is such a big thing. It's a great difference in a guy's life if he does not have that concern. So when you're balancing things out, prostate health here versus fear of going to get prostate checked out, it really does come down into the fear angle. You can remove that altogether, because this is something that every guy should be doing, and because of the advances in the industry and all across the medical community, it's something that is it's treatable, it's beatable, it's manageable, isn't it?
It is. And I often find that patients, just the thought of going to urologist has a certain stigma to it. So, they're embarrassed to talk about personal issues such as urination, the problems that they're having, urination, erectile dysfunction. So, that keeps gentlemen away. And then, like I said, also the fear of having the knowledge of how it used to be. Mm-hmm. Most of my gentlemen now that do go through the process afterwards will say, boy, I'm upset that I put this off for so long, because it really makes things so much drastically better for them. When the prostate starts to obstruct, it's a very slow process. I often say it's like when I got glasses for the first time. I didn't even realize I couldn't see. And so since it's such a slow process and nobody keeps notes on how other people are urinating, many people hold the belief that this is just old age. So they just live with it and adjust to it and adjust their lifestyle to, urinating every hour, waking up throughout the night. Like I said, a lot of leakage. And they just learn to live with it. And that's just a misnomer. You do not have to live with it, and it's not just a part of getting old for males or females. Stephanie,
is there danger for folks who wait too long?
There is. Often what ends up happening is prostate cancers tend to jump to the bone very frequently if they metastasize. A lot of gentlemen will end up caving to the back pain, because it will jump into the vertebrae. And that's what they notice if they're not getting routine PSAs. It's already moved. It's gone throughout the body. Now, we can still treat it at that point, but like I said, it gets much, much more involved at that point. So the goal is always to, catch the cancer before it moves, before it spreads throughout the body. So then, it's a much more simplified process at that point.
Yeah, that early intervention is the key.
Yep.
All right, Stephanie. So what should folks be doing right now if they find themselves in that category of guys who should be getting their prostate checked? What should they do?
Well, around the age of, talk to your family first of all. Men don't, often share, especially back in the older generations. They don't share because, like I said, this can be embarrassing. So talk to your fathers. Find out your family history. Do you have a strong family history? If you do have a strong family history, you're under the age of 50, go to your family physician and just bring it up and ask to have your PSA checked. If you have a really strong family history, it would be advisable just go ahead and start with a urologist. You're going to need to be routinely screened and watched closely throughout your years. And if you're at the age of 50, you should start routine screening for prostate cancer, which includes a yearly PSA. And also, we palpate the prostate to see if we feel any abnormalities that could be indicative of prostate cancer, as well as taking a very accurate health history.
All right. So that being the case, if someone wants to do that with Dr. Maliver's office, what do they need to do? Is there a phone number?
There is a phone number. You can call our office directly at 724-349-7820.
She is Stephanie Wingerter, our certified registered nurse practitioner in urology services at IRMC in the office of Dr. Maliver. Stephanie, thanks so much for being with us today. Appreciate it.
Oh, thank you so much. You have a great day.
You too. Bye now.
Bye-bye.
It is the voice of Indiana County, WCCS, 101.1 FM and AM 1160.